Hi, good evening, everyone. This is Sharice Davids, your representative in Congress. Welcome to our call with your Congresswoman tonight. Thanks for taking the time to join us. It's really important for me to do these so we can stay connected with you. Tonight, we're going to give you an update and answer your questions about the coronavirus pandemic. So my job as your representative is to serve every single person in every corner of our community, and listening to you is a really important part of that. It helps me do my job better, and that's whether we agree on every topic or not. So I'd like to hear from as many people as possible tonight. It does take a bit of time for everyone to join our call, so please just bear with us for a second. But while we wait, you can ask a question by pressing *3 at any time to get in that queue. And then my staff is here to help you navigate the federal government, and you can press *6 to get help. We can help with things like veterans benefits, Medicare issues, and more. So I know a lot of folks have questions and concerns about the coronavirus. So I've invited Dr. Greiner, the Chief Medical Director and Public Health Officer for Wyandotte County in Kansas City, Kansas, on the call with me tonight to help answer your questions. I'll also share a bit about the work we've been doing to address this public health emergency. So thanks again, everybody, for joining, and we're going to get started shortly. Just a reminder to please press *3 to get in the queue to ask a question. You can press *3 at any time during the call, or you can press *6 at any time during the call to speak with someone on our team here in Kansas to help you navigate the federal government. That's things like veterans benefits, Social Security, Medicare, that sort of thing. So we're just giving folks a little bit of time so we can get everybody onto the call here. So just making sure for anybody who's gotten on in the last few seconds here, this is Sharice Davids, your representative in Congress. Thanks for joining our call with your Congresswoman tonight. First of all, I appreciate folks who are taking the time to jump on the call, and I want to hear from as many people as possible. It takes a couple minutes for everybody to get onto the call, so just bear with us here for a couple of minutes. But while you're waiting, make sure to press *3 if you want to get in the queue to ask a question, or press *6 to get help with issues you might be having with the federal government. Our team here in Kansas is our job is to help navigate issues you're having with the federal government, so things like veterans benefits, Medicare, Social Security, that sort of thing. Okay, it seems as though we've got quite a few people on the line now, so we're going to go ahead and get started. First, I want to start by sharing a couple of updates, and then I'm going to introduce Dr. Greiner, and he'll share a bit about himself and the work he's doing and a few thoughts. Remember, press *3 at any time to get in the line to ask a question, or *6 to connect with our team here in Kansas. We're here to help navigate federal government issues, things like veterans benefits, Social Security. So first, I think, all of us are experiencing this very difficult few weeks we've been in here. Some are feeling it more than others right off the bat, but all of us are feeling it in one way or another here in our community and the country as a whole. I know we're all doing our best to navigate the public health emergency we're in, and these are pretty trying circumstances. We're seeing the devastating impact of the virus here in Kansas. Unfortunately and tragically, we've already lost 9 of our neighbors, and we have a long road ahead of us. I can only imagine the grief the families and community are feeling and dealing with right now, and my heart goes out to the folks who are suffering. In addition to that, we've got an unemployment rate that's skyrocketing, and lots of small businesses that are struggling, and others who are, people who are doing their best to balance things like childcare needs and telework. We also, though, have people in our community who are doing everything they can to stay healthy and help protect friends and neighbors or parents who are older, or people that they care for that have chronic health conditions. And through all of this, our medical professionals are working around the clock to keep people healthy and safe. And we owe a huge debt of gratitude to our doctors and nurses and other healthcare workers who are doing just an incredible job under extremely difficult circumstances. We can look to them, to all of those folks and so many others who are on the front line of this crisis for inspiration. And, when we stay home and practice our social distancing measures, we are potentially saving the life of somebody who is not able to stay home during this time. I know it's not easy, but I know we're going to overcome this challenge together by looking out for one another and following the advice of medical experts. Our team is going to be here for you and our community every step of the way as we navigate this public health crisis we're in, and we're going to help in any way we can. So one of the things we've seen and that we know is that people need information, resources, and help now more than ever. And we've created a coronavirus resource center on our website, which is at davids.house.gov/coronavirus. And we're updating that very regularly. At davids.house.gov/coronavirus, you can find the latest public health information from the CDC, local public health resources, how you can apply for disaster aid if you're a small business owner, how to access unemployment insurance, food assistance, and a lot of other things. You can also find out what Congress's last emergency relief legislation means for you and how it might help you. Again, our coronavirus resource center is at davids.house.gov/coronavirus. I also would ask, please join our email list while you're there on our webpage so that you can get the updates about resources and news about legislation we're working on, and all the steps we're taking to address this emergency. So having said all of that, I'd like to now introduce Dr. Alan Greiner. Dr. Greiner is the Chief Medical Director and Public Health Officer for Wyandotte County in Kansas City, Kansas. And Dr. Greiner, I can't tell you how appreciative I am. We're so happy to have you on the call with us this evening to help answer people's questions. If you could take a minute to introduce yourself and maybe share updates you might have for us.
Absolutely. Thank you, Congresswoman, for having me here tonight. Again, I'm Dr. Alan Greiner. I'm the medical officer at the Unified Government Wyandotte County, Kansas City, Kansas Public Health Department. I'm also a family physician and faculty member at the University of Kansas Medical Center, where I direct the community engagement program for our Clinical and Translational Science Institute there. But the last 2 weeks, I've pretty much spent every day here at the Unified Government Public Health Department in downtown Kansas City, Kansas, because we have something going on that really I haven't seen in my career as a medical doctor and as a public health professional. I've been the medical officer here for 14 years now, and we've never had anything like this in Kansas and certainly in Kansas City. We are facing a novel coronavirus, as most people know now, COVID-19, that is highly contagious and causes severe medical complications in especially the vulnerable individuals that it infects. And we're seeing things in the news every day about these issues, but now a lot of us are facing them firsthand. We've had a pretty dramatic increase of cases here in the Kansas City metro area as well as across the state of Kansas in the last 2 weeks. It was just 2 weeks ago that I went with our mayor over to Topeka to announce the first case we had in the state of Kansas and the first fatality. And now we're up to the latest count we've got on the website for the Kansas Department of Health and Environment has 482 cases with 114 hospitalizations and 10 statewide deaths. These numbers are changing literally every minute. In the Kansas City metropolitan area, we currently have 93 cases in Wyandotte County and 4 deaths. As of this morning in Johnson County, we had 144 cases and 3 deaths. On the Kansas City, Missouri side, we've got 119 cases, and in eastern Jackson County, we have 72 cases and 2 deaths. So we're getting quite a few here, but really most of the state of Kansas is not being spared, and things are expanding rapidly. The last I looked at this interactive map, Douglas County now had 30 cases, Leavenworth County had 25 cases, Shawnee County has 18 cases, and things are spreading from there. We've done a lot of things, and I'm sure everyone's seen the news about all the things going on, but we've all got to work together to slow this down and make sure that our healthcare systems don't get overwhelmed. Because of the severity of medical complications this virus can cause, in older adults and in adults with chronic diseases, if we don't slow it down, we will get a peak of cases that comes sort of all at once. And we've seen that happen in other countries, and we've seen that happen in New York, and folks have probably seen that in the news. We don't want the situation where our hospitals are full and there are no ICU beds and there aren't ventilators, which are the machines that do artificial breathing for a very, very ill patient with significant lung problems going on, and we have to start making decisions about who gets that intensive treatment and who doesn't get that intensive treatment in a crisis. So we're working really hard with the measures, and I would urge everyone to really follow through with the recommendations and stay at home if at all possible. Everything you can to social distance yourself. If you do have to go to the grocery store, or you do have to go to a pharmacy to pick up prescriptions, or you need to go to a hardware store because you've got to fix a clogged drain, stay 6 feet away from everyone when you're in those environments. Space yourself out. Practice the personal hygiene that everyone's been talking about in terms of frequent hand washing, staying at home if you're sick, coughing into your elbow, not touching your eyes, mouth, nose with your hands, and really, again, staying around the people you live with. Even family gatherings with family members that you think you know and trust, somebody could be asymptomatic, and we now know that some asymptomatic individuals that have no symptoms can pass this virus to family members and others. So we are urging people to stay only around the people you live with, and otherwise stay 6 feet away from everyone else. And if we work together on that, I think we can save our healthcare system from being overwhelmed and the tragedies that would come along with that. So thank you for letting me take the time to get all that across.
Yeah, I appreciate it, Dr. Greiner, and again, I appreciate you joining us this evening. We're gonna jump into the questions here. For folks who might have joined while Dr. Greiner was sharing a bit of an update about what's going on here in our community in the metro area, but also in the state. If you're just getting on, please press *3 to get in line to ask a question, or *6 to connect with a member of our team here in Kansas who can assist with issues with the federal government, things like Social Security, Medicare, those kinds of things. Our team's here to help with that. So before we get into the questions, I do want to share a little bit about the large bipartisan economic relief and coronavirus response bill that we passed, and I did support the bill. The president signed it as soon as it hit his desk, and that bill is now law. And although the bill wasn't, it was far from perfect, but it does start to provide some immediate relief to medical professionals on the front line, working families, and our small businesses who need help. All these folks need help right now. So just a couple of high points on that. The bill gives direct rebates to Americans to help provide some financial relief during the emergency. There's improvements in there to unemployment insurance, including providing an additional $600 per week amount for the next 4 months. There's billions in there for disaster aid to small businesses to help keep them and their employees afloat. And there's a new emergency fund for hospitals across the country to make sure that our doctors, nurses, and healthcare workers have everything that they need to keep themselves and their patients safe as they fight this pandemic. And then lastly, there's some accountability measures in there so that we can guard against waste and fraud and make sure that real people are actually getting real relief. And we're going to work to make sure that this administration, our federal government, is taking the right steps to implement the relief as immediately as possible to help the health and safety and the economic security of our neighbors and loved ones while also providing accountability. Last thing, make sure to visit davids.house.gov/coronavirus to learn more about the different pieces of legislation that we've already passed and have been signed into law. And we're going to go ahead and start taking some questions now. So the first question looks like it's from Jeff. And Jeff wants to ask a bit about some testing availability. Are you there, Jeff?
Yes, I am.
Hi, go ahead.
Well, first, thank you, Congresswoman, for doing an excellent job for us. We appreciate your advocacy. My question is, when can we realistically expect to get more testing available? For example, just today we saw a patient, one of my partners did in our clinic, who was discharged from a hospital, Centerpoint, so over on the Missouri side, that saw us in Overland Park. He has been short of breath for 2 weeks and having trouble breathing. The hospital did not test him because he did not have a fever, but there are obviously many patients with COVID-19 who do not have a fever. That's been well reported. So if we're stuck with limited testing, we can't test everyone. Now this gentleman is out in the community and, could be spreading it to his loved ones, and I don't know if he is working in an essential job or whatever. So when can we realistically expect more testing?
Yeah, well, thank you, Jeff, for asking about this. This is an area, and I'll also, I have a little bit to say, and then Dr. Greiner would love to hear from you on this as well. So the first thing I would say is that I think there are so many of us who have, I know I've felt frustration, and I've talked to so many people in our district here and in our state who are feeling the frustration of there being just not enough tests. The tests haven't been available, and I have personally been advocating for our region. I know we heard it earlier. Because there's not enough supplies or testing, the state is having to make difficult decisions about how to allocate resources. And, I've said this multiple times. My job is to try to make sure that we get all the testing and the supplies that we can for the state, but for this community. And you heard the numbers earlier. We're feeling it most severely right now in our district. And so I've called on the president to invoke and utilize the Defense Production Act, and we've seen him do that now in the last week or so around ventilators. My hope is that we'll see that ramp up for things like testing and the personal protective equipment like masks and other things that are that folks who are on the front lines of this stuff need. I'm gonna keep fighting for that stuff. I spend a lot of hours each day trying to figure out ways that we can get more of that stuff out here. Dr. Greiner, I don't know if you have any information you want to share about when we might be able to see more testing in the area.
Thanks, Congresswoman. Yeah, and thanks for the question, Jeff. It's a great question. A lot of us have been fighting hard to try to get testing expanded, knowing that it will really help us fight this pandemic. And the positive news is it's really starting to shift, and it's starting to shift fast. I think people are realizing the importance of this, and we are seeing the kind of the entrepreneurial spirit, certainly around here in the middle of the country, and labs they're getting approved by the FDA and launching. We've got a lab we've been in discussions with in Wyandotte County that'll be up and running this Friday. They're offering relatively good discounts on testing to us, so we were able to secure in Wyandotte a little bit of budgetary dollars to start our own testing at the health department here in Wyandotte. The Johnson County Health Department has done the same thing, and we'll be doing expanded testing in the coming days, and there should be information in the press out on that in the next 48 hours. But a lot of it is due to innovation that's happening by the bioscience companies in our region and I think across the country. I think we're going to see point-of-care testing, which we should have had long before now, where you can get a test back in 10 or 20 minutes like you can with influenza tests when you go to see your regular provider. It's so valuable to have that information back quickly, and we've had a massive backlog in the testing that has been available, especially from the larger reference labs, both in the region and across the country. It's taking 7 to 10 days sometimes to get test results back, which really hampers our ability to act on information and do the kinds of things that we need to do, like isolate those that are infected and quarantine those that have had close contact with those infected folks. So the case you mentioned, Jeff, is a great example where if we would have had more information, we could have acted sooner and probably limited spread more widely. I think it sounds like you're a medical professional. I think we all have to work as healthcare professionals to advocate for this. I'd like to see the federal government reimbursing for testing in this pandemic environment. We don't have that locked in yet, so some of us are trying to raise grant dollars to do this work, but we've just got to all advocate together and push for the information we need to make a difference and really preserve the resources that are there.
Thank you, Dr. Greiner. So I appreciate you bringing up the additional funding that the Unified Government and that the Johnson County Commission both passed, because that's going to be really helpful in making sure that we that once the testing is up and going, that we actually have the resources allocated for that. So we're going to go to the next question now, and hopefully she's still on there. Heather had a question about, I think we lost her. Off the line. So one of the things while we're pulling up the next question here, one of the things that I wanted to mention is those reimbursements to the state and local, the state governments and local governments around not just testing, but also some of the other outlays that are going to need to be made. So one of the things that the most recent bill created was a $150 billion state and local coronavirus relief fund. And from the estimates that we reached out and got from experts, they say that Kansas should receive about $1.25 billion to help with our state's response to this. And And so that's going to be a really important piece of making sure that those resources are there because, like you said, Dr. Greiner, right now our counties and more local governments are really, because our local governments are really acting in a way that's going to save people's lives by asking people to stay home, but also by allocating resources for testing so that as soon as it's available, we're able to get started right away. So the next question is from Randall, and I think he has a question about masks. Randall, are you there?
Yes, ma'am, I am. Thank you for your hard work, and we appreciate it.
Yeah. So I thank you for getting on this call and asking a question. Go ahead.
My question is, obviously in California, they seem to be, flattening the curve, and they're actually recommending that people, when they go out and get groceries, to wear masks, whether it be a bandana, just a protective covering over the nose and mouth. Is that something that we should be doing here in the Kansas City area? I'm in Olathe and Overland Park, and it's just I want to make sure that if we're out there and we have to make that trip to go get groceries, or we have to make that trip to the pharmacy, that we're doing everything we can to protect ourselves. And since they seem to be a little bit ahead of the curve and they're, by the numbers, flattening theirs, I just wanted to see if that's something we should be following suit with.
Yeah, well, thank you for asking that. I'm curious to hear that answer as well. Dr. Greiner, is that something that you could chime in on?
Sure. It's one of these topics that I don't think we have great scientific data on yet, but as with much of this pandemic, we're having to make decisions sometimes based on guesswork and what common sense would dictate. So we may not get a scientific answer to that question in time to sort of make decisions. What I think the initial recommendations we had out of the CDC, say 3 weeks, 4 weeks ago, were that it was not recommended that individuals in the general public wear masks for protection. And a lot of the worry around that, I think, was that people who wear masks and haven't been fully trained in it and haven't been trained in infection control practices, they're going to be touching their face to put the mask on and take the mask off and to readjust the mask. And that touching of the face is something we really worry about with this virus, because we think a lot of the spread is caused by people coming into contact with the virus on inanimate surfaces. We know that the virus lasts at least some period of time on especially hard surfaces like metals and plastics, and then they touch their face. So we were worried people would do that if they were wearing masks a lot. What I think states like California are seeing is that maybe they could have people wear masks, not so much to protect themselves from contracting the virus, but it may actually protect the community, because a lot of people may have the virus, not know it, be completely asymptomatic, and if they're wearing a mask in public, in some ways they may be less likely to spread it to the rest of the public. So if they were to sneeze or cough, they're not going to aerosolize small particles and have virus in that might infect others. So we don't know where the CDC is going to come down on this, but things are changing every single day. So I think people need to do what they're comfortable doing, and feel free to do that. The most important, though, is the social isolation and staying home as much as you can. But I think we're going to, as a society, accept this, and I think we've seen great community participation and interest in knocking this all down by working together. And so I think people should do what they want to do and keep watching the news, because we'll probably have more guidance on this soon.
Okay. Well, thank you. And I think that part you mentioned about, of course, the social distancing and staying home if you can, but folks have been asking us if they should be wearing masks as well when they go grocery shopping, whether it's through our social media and that sort of thing. So it's good to know that, if you are wearing a mask, that it might actually protect other people, but recognizing that you still might, you need to make sure not to touch your face.
Right, and
that sort of
if you're gonna wear one, make sure you are washing your hands for at least 20 seconds before you put that mask on, and before you touch that mask to take it off, or at any time to readjust it, wash those hands again for 20 seconds, or use some kind of hand sanitizer with more than 60% alcohol. That will really protect you if you are going to do that.
Okay. Thank you so much. I appreciate it. The next question is from Rhonda, who I think has a question just kind of about looking forward and what we should be preparing for. Rhonda, are you there?
Yes.
Oh, hello. Go ahead.
Hi there. Thank you for having this and, helping us kind of understand what's going on in our community. But are there going to be any drive-through testing for antibodies just to see how widespread this COVID virus is in Wyandotte County so we can kind of gauge where we're at?
That's a really, really good question, Rhonda. Thanks for asking that. So for sure, Dr. Greiner, you're going to have more to say on this than I do. But I can tell you that that's actually one of the things we've been pushing for is to make sure that we are getting an adequate amount of tests out here so that so we can just increase the number of tests that the professionals are able to give. And that means, from my perspective, that means advocating for funding so that we can do that and trying to figure out ways to get more, particularly the testing. I know there's some backlog on the swabs and the collection piece of that. And so, Dr. Greiner, do you know whether or not the drive-through testing is anywhere on the horizon for us?
Well, so we do have some drive-through testing currently in the metro area for virus detection testing, which amplifies the genetic material of the virus and detects it. So the St. Luke's Health System is currently doing some drive-through testing for certainly patients in their system. There is also drive-through testing here in Wyandotte County at Southwest Boulevard Family Health Care. We will have drive-through testing set up here at the health department on Friday, again, mostly because we've had these companies coming forward with testing capacity. Antibody testing, which is a little bit different that you asked about, is really detecting the formation of antibodies in a person's system that show that you've been exposed to the virus at some point. And that takes a little time for those antibodies to show up. We don't have widespread antibody testing in the United States. In fact, I don't know if we have any in the United States, certainly not in this region. Internationally, there has been some. I'm confident we will have it in the United States soon, again, because we have a bioscience industry community that is innovative and will come up with things quickly. If we can get it quickly, it will help us because it will give us a sense of how many people have already been exposed and how many of them did not develop symptoms at all. So we hope that that's something that comes along quickly and is affordable for our healthcare system to adopt, so that we can work through this. If we can slow the virus down and not have a peak that occurs really, really fast in terms of new cases, that'll give us more time to develop these kind of innovations that can help guide us. But that'll be a little bit different test than what we're doing now, where we're just trying to detect the virus itself rather than the body's immune response to the virus.
Hey, Dr. Greiner, would you be able to just, real quick, you said a couple of things that made my ears perk up. You mentioned that there were a few places doing drive-through testing in the metro area, and I don't expect you to know all the stuff going on the Missouri side, but definitely with the testing that's going on here on the Kansas side, can you tell us a bit about, how are you or whoever's doing the testing, how's it being decided who's going to get tested, and how does the process work?
Yeah, so that's been another thing that's been changing rapidly over time, really for everybody across the United States in terms of who we ought to test. As one of your callers mentioned earlier, there are patients out there who probably have respiratory symptoms but no fever, and originally we're thinking we should only test people who had both fever and respiratory symptoms like cough or shortness of breath, but now I think people are moving in a different direction. In Wyandotte County, the health department here worked with the Southwest Boulevard Family Health Care Clinic to set up their protocols, and we've already loosened the testing protocol with them to some extent. So initially, again, we wanted people with fever and cough. Now if people have a fever, they can get tested. We would like people to go through their regular doctor, but there are a lot of people who don't have a regular doctor, or some people who have a regular doctor who doesn't have the proper kits to do the testing or the proper arrangements with the local lab to facilitate that. If people are interested in testing in Wyandotte County, and especially if you don't have a doctor or if you receive care at one of the local safety net clinics in the metro, you can call the hotline that Southwest Boulevard Family Care has up. That number is 913-396-7070, 913-396-7070. In addition to that, in Wyandotte County, we set up a symptom self-reporting tool on our government webpage. So at wykokck.org, on our COVID page, you can go in there and report your symptoms. We have healthcare professionals that call all the individuals that do that back within 24 hours and give them guidance on whether to seek testing, whether to isolate themselves, decisions about social distancing. We want to expand that, so we would love anyone who's a Wyandotte County resident to go to wykokck.org, and especially if you have symptoms or you know anyone that does have symptoms, and we're talking about fever, cough, shortness of breath, sore throat, fatigue, body aches. We're even seeing people with nausea and diarrhea at this point as well. We would like to hear about any of those symptoms, and we will follow up with you. And because we'll have additional drive-through sites going by Friday, we can route people to that. In Johnson County, and I just spoke to their health director earlier today, they are going to have a self-reporting opportunity on their website starting, I believe, in the next 48 hours. So if you're a Johnson County resident, you should watch the Johnson County Health Department website, because they will allow people to go in there and report symptoms as well, and then they will be launching extensive testing as well in Johnson County. We've done this. We've gone to some of the self-reporting because initially we didn't have all the testing we need, but now that we're getting more testing, I think this is a great opportunity for people to help us keep track of what's going on, especially spreading the news amongst those you know, so that if people say, oh, I don't have a doctor, or I don't know what to do, but I've got this fever or this sore throat, go to these websites and you can enter your data for us, and then we'll try to coordinate, and it really helps us keep a pulse on what's going on across the broader community.
Thank you so much. And you mentioned a couple of things: the hotline number, the self-reporting tool, and that for Wyandotte, and then the self-reporting that Johnson County's going to be implementing in the next couple of days. Going forward, one of the things, we've got our davids.house.gov/coronavirus resource center, and we'll make sure to include the information that you just shared with the hotline and with the self-reporting tools. We'll make sure that we've got that on our page too, so folks have access to that. Hopefully, Artie is still here. I think Artie had a question about SBA and small business relief.
Hi, Sharif. Thank you for taking my call.
Thank you for joining our call tonight.
My question was, with the influx of money that Kansas will be getting from the stimulus package, will there be more funds made available for the higher loan? I missed the first round. I was declined. And also for SBA loans and grants that are coming through, do you know about how long those are going to take to be distributed?
Well, Artie, thank you for getting on and asking about, the first of all, I've heard from so many small business owners and of course not so small business owners too, and the people who are working with small business folks. I mean, here in this area, I know we have so much entrepreneurship. It's really the backbone of this area. The kind of bigger picture, the most recent relief package did include a lot of resources in there. There was $375 billion for the small business relief, and that includes funding for forgivable loans to small businesses to help continue to pay their employees and keep people on payroll, because sometimes that's a really hard thing. And then debt relief for people who are currently, I know you said you weren't able to get the last round of funding, but debt relief for current and new SBA borrowers. And then there are immediate disaster grants that are going to be available there. So one of the things I would ask folks to do is please call our office directly. For right now, if you're on the line and you want to talk to our team about SBA, the small business, just whether it's loans or grants, the disaster relief, you can hit *6 and you can get connected to somebody on the team. And then the other thing you can do is we're working with the SBA, and right now they're being inundated. SBA, of course, is a very important agency and does a lot of work, but they also are having to scale up a bunch of their programs because they are doing everything they can to help the small businesses. And I think that one of the things I would just ask for folks to do is to make sure to apply for the SBA relief. We have on our website, the davidstotthouse.gov/coronavirus, we have information on there about the various programs and can help with applying for those. I think that one of the most important pieces right now is that this is not the end of the line. I think Congress, we've passed these couple of relief packages to help our small business owners, but there's going to be a lot more that Congress can be and frankly should be doing. In terms of timing, I think it's so specific to the different types of small business programs that I want to make sure not to mess up anybody's expectations and that sort of thing, but would just ask, please call our office, and you can press *6 to connect with somebody on our team. But also, I'm going to give you the phone numbers for our two offices right now, so if folks are able to write those down. I'll say them again at the end of the call tonight, but for now, the Overland Park office is 913-621-0832, and then the Kansas City, Kansas office is 913-766-3993. It's just going to be really important as we go forward to help the small businesses. All right, so I'm going to go to the next question. It's Kenneth, I think, is hopefully on the line, has a question about the stimulus checks.
Yeah.
Go ahead, Kenneth. Thanks.
All right, thank you.
Calling in.
I had a question. If I didn't file income tax last year because I didn't make enough to file, but I do get Social Security, will they send the stimulus check to Social Security, or would I have to contact them?
Kenneth, thank you so much for calling in about this, because this is something that a lot of folks are asking about. And while the IRS is getting the stimulus check program up and running, I want to make sure that folks know to call our office. We want to make sure that we're giving out the right information, and we're literally in the middle of making sure that for folks who do have Social Security, have various circumstances around whether they filed taxes or not, I would ask if you could please, for folks who are in a similar situation, press *6, and we'll get you connected with somebody on our team. And then, Kenneth, I hope we already have your contact info, and we'll follow up with you to make sure that we get you all set up to make sure that you get the relief that that you're due, and that so many people need right now. And thank you, Kenneth, for calling in and asking about that, because I think a lot of people are in the same boat and wondering. So please press *6 if you're trying to figure out the stimulus economic relief related to coronavirus that we just passed. So we've been on for a little while now. I think we're going to move into what is probably our last question. Brian should be on the line. I think you had a question about about the spread of the virus.
Yes, I heard today on national news that the coronavirus can become infectious, or the contagion of an infected person can be spread 48 hours before symptoms appear. Since the incubation period has been stated as 2 to 14 days, does that really mean that the person can start spreading the infection on day one, or exactly what does that all mean then?
Thanks for asking that question, Brian. I think I have also wondered about that because I've read about the incubation period too. Dr. Greiner, can you help us understand this a bit better?
Sure, and again, I think this is an area we're still looking for additional data and scientific studies so that it'll guide us, but we do have more and more evidence every day that individuals can spread the virus to others before they have symptoms, and individuals who never develop symptoms and are what we would call asymptomatic carriers of the virus can spread it to others. What we're doing right now, and this is the guidance of the Kansas Department of Health and Environment, is that if an individual eventually tests positive for the COVID-19 virus, we ask them what day their symptoms first occurred, and then we go back 2 days before that date, and anyone they had close contact with, we ask those individuals to quarantine for a total of 14 days after the last contact they had with the case. And the reason we're doing that is just what you stated, that we believe that those 2 days before symptoms develop, it's likely that the amount of virus in somebody's system is getting high enough that they could potentially transmit it to others. We don't know, and again, we're changing all the time with this, and we really appreciate everyone's patience as we change modalities and strategies, but we could expand that further forward than 2 days, and we may expand how long we keep people in isolation and away from others once they start recovering from their symptoms as well. It's a moving target, but again, taking those personal protective measures in terms of socially isolating yourself and getting your friends and family members to do that as well, and practicing personal hygiene like we talked about, that's what we've all got to focus on because there's so many unknowns with this pandemic.
Dr. Greiner, thank you so much for that. Listening to your answer reminded me about a couple of things. One, I went into self-quarantine because a colleague of mine tested positive, and we went through that exercise actually. I had been in contact, not physical contact. I stopped shaking hands, and even I wasn't doing the elbows or any of that stuff. But we were in pretty close proximity at a meeting, and that was 2 days before he started exhibiting symptoms. So at at the recommendation of the House physician and the CDC, I did a self-quarantine right up till the 26th of March. And, I think that us being able, especially for those of us who are able to work remotely and virtually and that sort of thing, I just felt like it was really important to follow those guidelines and self-quarantine. And then hearing the just that you all are you're professionals and experts, but this is a new or novel, as they call it, coronavirus, and so some of the dates might change or the amount of time, and keeping that in mind just helps us, I feel like, understand a bit better why it's so important to follow the hygiene recommendations about washing your hands for at least 20 seconds, avoid touching your face, and then social distancing, because as we go forward, the slower the spread is, the more likely it is that we'll be able to literally save folks' lives. So thank you so much for taking the time today to come on and answer these questions for us. There's one last thing I want to mention that we didn't we had a caller ask about, but that person didn't get on the line, and that's about unemployment. There's a lot of folks. We've seen the unemployment rate skyrocket, and I wanted to make sure to let folks know that our Department of Labor here in Kansas is working really hard to try to make sure that folks are getting the help that they need. We hosted a Facebook Live event with doing a Q&A with Secretary Garcia yesterday. If folks want to go on there, she gave a lot of helpful information. But one of the biggest things that she did was gave us the website, and that's getkansasbenefits.gov. And Kansas is spelled out, so getkansasbenefits.gov. And you can file for unemployment and access to those critical resources at that website. The need for us to be helping each other out cannot be overstated. So we're going to go ahead and wind down here. For folks who weren't able to ask your question, please know that we have your information. We've taken it down. We're going to follow up with a response. And then if you want to ask a question but you didn't already press star 3 or haven't spoken to somebody on our team, just stay on the line. And then when the call is over, you can leave a voicemail, and then we'll follow up with you based on that voicemail. So, Dr. Greiner, thank you again for joining us. And thank you to everybody who took the time to get on this teleconference, which is the teleconferences are a new reality for a lot of folks. So I appreciate everybody doing that. It especially in times like this, I feel so honored to be able to work for all of you. I know it's not an easy time at all. Our community has come together in so many ways, and it makes me feel grateful and optimistic about the way our community is going to be able to overcome this challenge. Folks are looking out for one another, and I can see it. I can see it in social media posts and from the calls I've been doing that people are really trying to follow the advice of our medical experts like Dr. Greiner. So thank you to everybody who's doing that. We're going to keep updating our Coronavirus Resource Center, which is at davids.house.gov/coronavirus. We want you to have the information and resources you need for you and your family. Also, please never forget that we're here to help you with the red tape of the federal government. That means things like Social Security issues, adult passports, veterans benefits. So if you need help with any of those things, you can always call us in Overland Park at 913-621-0832. and in our Kansas City, Kansas office at 913-766-3993. So that's going to be the end of our call for tonight. Thanks again for everybody getting on and for the folks who asked questions. And please stay on the line and leave us a voicemail if you haven't had a chance to speak with anybody on our team yet so we can follow up with you. Thanks again for joining us, and have a good night, everybody, and I hope you all are able to stay safe.